hiatus. Had a different project I've been working on, but nonetheless, we are back. I'm going to be changing up the structure of this a little bit. I'm going to have more of a focus each month, kind of shifting the sports medicine a little bit more. And since I'm recording this in March and the baseball season is gearing up and ready to go, we're going to start with a little bit of baseball. And today's article is titled Preseason Shoulder Range of Motion Screening and In Risk of Shoulder and Elbow Injuries in Overhead Athletes, Systematic Review and Meta-Analysis by Pazzi et al. So there was 15 studies included in this review. Over 3,000 overhead athletes were screened. Nearly 75% of those were baseball players. Other sports including softball, volleyball, handball, and I believe swimming. Keep in mind that in these article reviews, the female athlete was very underrepresented. Only about 12% of the overall sample were females. And we're going to be focusing on the external rotation portion of this systematic review. The article states that professional baseball pitchers whose external range of motion in the throwing arm was not at least 5 degrees greater than their non-throwing arm were twice as likely to sustain an in-season shoulder or elbow injury. Similar findings were not observed in adolescent or high school baseball pitchers. So why is external rotation of the shoulder so important in pitching? Well, I think if you just look at the motions that a pitcher goes through before delivering the ball, moving from the late cocking to the acceleration phase, there's a significant amount of external rotation that pitchers utilize to whip the ball forward at such high speeds. In everyday life, 90 to 100 degrees of external rotation is considered pretty good when you're measuring with the shoulder out to your side in a 90-degree abducted position. But it's really not uncommon for pitchers to have 120 to 160 degrees of external rotation as they're moving through that acceleration phase. So a good preseason measure would be to compare the throwing and non-throwing hand, and if the athlete does not have at least 5 degrees more external rotation in the throwing arm than the non-throwing arm, then it does place them at a higher risk of injury to the shoulder or elbow. And if you find that this is the case for yourself, or maybe you're a coach and one of your players is experiencing this, I wouldn't have them partake in aggressive stretching of the shoulder because that can lead to other issues, including nerve irritation, muscle irritation, ligamentous instability, especially if the player is already prone to having a little bit more hypermobility, which would likely mean that the issue is more with soft tissue restrictions that can be worked out with a lacrosse ball, a tennis ball, IASTM tools, myofascial decompression or cupping as it's commonly known, dry needling from a licensed provider, and if you're seeing a physical therapist and they determine that there is in fact joint hypomobility, then they can apply the correct mobilizations and teach you some exercises to work on at home. But the common muscles that you're going to look at for limiting external rotation would be the pectoralis muscles and subscapularis. So in closing, try to find someone to screen yourself or your athletes, and if needed, follow up with a physical therapist in your area that has experience with overhead athletes and hopefully more specifically baseball. Thank you. Have a good one.